to look at the vaccine and their types. So we are going to ask some questions. The first question being, what is the BCG? What type of vaccine is the BCG? And the second question is, what type of vaccine is rabies? So in this video, we'll find the answers to these questions and learn in detail about the vaccines. So first, we need to know the category of vaccines. So if you see the vaccine, it is divided into different categories. So we are looking at each one of them. First one will be the live attenuated. Next is the killed whole vaccine, killed whole organism. Then we also have the toxoid. There is a toxoid or the protein. Then comes the polysaccharide, and then comes the glucoconjugate and also the recombinant. So these are the broad categories, and now we will be dealing with each one of them and looking at the examples. So the first one is the live attenuated. So under live attenuated, it includes the mumps, and after mumps there is also the BCG which is present. Then the plague, it also includes the influenza, and the influenza is the cold adapted variant, cold adapted. Then there is also the typhoid. This typhoid, if you see, it is nothing but it is oral. Then comes the yellow as well, the yellow fever. And beyond this, there is also the rubella and also the rotavirus. Next, there is the oral polio. The oral polio is nothing but the sabin. And next, there is the measles. Then the Japanese encephalitis and also the varicella. So all these vaccines comes under the live attenuated. Next, we'll move on to the killed whole vaccine. So under the killed whole vaccine, so under this it includes the rabies, then influenza, next also the polio, that is the IPV and the Salk. Then it includes the Hep A as well. Then the cholera also comes under the killed whole vaccine, and the encephalitis as well, and the typhoid. So the typhoid comes as a killed whole vaccine. So after this category, we'll be looking at the toxoid or the protein. So toxoid or the protein. So under toxoid of the protein, there is the diphtheria. There is tetanus. Next, there is also the cellular pertussis. And there is also the presence of the anthrax and the influenza. There is influenza subunit. Next, we look at the category of the polysaccharides. So under the polysaccharides, there is the pneumococcus and meningococcus. There is also the hemophilus. This is nothing but the influenza type B, and also the typhoid and the typhoid. Next, we are looking at the category of the glycoconjugate. So what is the category of the glycoconjugate? So under the glycoconjugate, this includes the pneumococcus, then also the MENACWY. So this is the meningococcal vaccine. Then looking at the recombinant. So under the recombinant, this includes the Hep B vaccine, then also the Lyme disease. Next, we also have the cholera. There is a cholera toxin B and the HPV. So this was about the vaccines and their types, categories. So now to answer our questions, we asked some 2 questions. So the first question we asked was, what is the BCG? So if you see BCG, it comes under the live attenuated type. The next question we asked was, what type of vaccine is rabies? So rabies, it comes under the killed. It comes under the killed whole vaccine. Killed whole vaccine.